So what are some of the measures your office has been implementing to ensure an improvement of minority health in this country?
So we have several strategic priorities. One of them is implementing the Affordable Care Act, supporting the implementation of that transformative law that was signed by President Obama in 2010. Because of the Affordable Care Act, over the past 6 years, 20 million Americans, including many people of color, have gained access to health coverage. We've seen in this country that for many years that people of color have often been having higher uninsured rates than others, and that impedes access to quality care.
What has been the level of education when it comes to health well-being of minorities in this country?
So we know that there's an important connection between education and health, and one of the key things that our office has done since its inception has been actually to educate minority communities about health and well-being and disparities, whether it's in areas such as infant mortality or diabetes, heart disease. Important campaigns that our office has led over the years to really provide information to communities so that A, they understand what are the risk factors for these illnesses, and B, how to actually be able to take charge of your health and improve one's health. But we also look at the systems, right? If you have access to coverage, ensuring that people have access to high quality care. And so working, for example, with healthcare delivery systems and others in understanding how to provide culturally and linguistically appropriate services to diverse communities.
Talking about diabetes, it is very prominent in the minority communities as well as in other parts of the world, particularly in Africa. How are you addressing this issue?
So one, it's important addressing risk factors for diabetes. We know and have seen, for example, in our nation, rising rates of obesity, even childhood obesity in our country. We were very excited actually at the 6th anniversary of the Affordable Care Act just last month that one of the features that we talked about was the diabetes prevention program. We had a project in which we funded sites across the country to be able to actually provide health education to communities about healthy eating and physical activity. And we found that the individuals who actually participated in that program were able to lose about 5% of their body weight. And by losing that 5% of their body weight, it actually reduced their risk of developing diabetes. So we know prevention is possible, and now we can take programs like that and look to our systems of delivery and care, and how do you expand and bring those services to everyone who is in need.
How you navigate the area of politics when it comes to health, as well as religion or non-religion when it comes to health in the minority communities?
Well, one, it's an understanding of really one's culture. The Office of Minority Health in 2000 released national standards for culturally and linguistically appropriate services in health care, and we updated those standards in 2013. One of the things that we understand with regards to culture are the various elements of culture. It's not only our race and ethnicity, primary language that we speak, but also spirituality that plays a great role in with regards to how one may seek care, what their experience is like in the healthcare setting, that interaction that they may have, and what their faith beliefs are as it relates to illness. It's an important thing for providers and others who provide services to understand what that means for an individual patient. And that's actually, as we're trying to transform our delivery system, that's what we're doing, is we're putting the patient at the center of their care.
Before we leave you, what would you say in the next 5 to 10 years' time will be the level of health improvement in the minority communities?
Preventive services, recommended preventive services to stay healthy, like blood pressure screenings and diabetes screenings. Those recommended preventive services are now available at no extra cost. That's important for minority communities because often cost was a barrier when you had to make a decision between getting a mammogram or paying your electric bill or buying books for your child. Now we have it that you can have access to those preventive services without having to pay an extra cost. We're also investing in community health centers, $11 billion going into community health centers that provide high quality, culturally competent care. This is an important source of care for minority communities who often lack a usual source of care because of the patients that are served. almost 2/3 of those individuals are racial and ethnic minorities. So we have really started to see a transformation of our health and health care for the nation in improving access, but also improving quality of services. And so the opportunity really abounds for us as a nation to really accelerate our efforts to achieve equity for all communities, including communities of color.
Dr. Gracia, thank you for joining us.
Thank you. It's a
Thank
pleasure.
you.